Hello everyone, we are now going to go over the lymph node biopsy flow cytometry plots from a 30-year-old man who presented with progressive weight loss and swollen neck lymph nodes. Let's start with CD45 versus site scatter. So this is a lymph node specimen and we expect majority of the cells or almost all of the cells in the lymphocyte gate. And that's what we are seeing here. All the cells are in this gate that expresses bright CD45 and low site scatter. Now, when we follow through, half of the population is positive for CD20, so they are the B cells, and they are negative for CD10, they are negative for CD34, and the B cells have a nice kappa population and lambda population, like in a polyclonal distribution. So this is 25%, this is 20% of the lymphocytes. So the ratio is almost like 1.5, 1 to 1.5 to 1. So that's nice. And B cells are negative for CD71. So nothing abnormal in this tube. Now, when we go to the next tube, we see that again in CD45 versus site scatter, majority of the population is lymphocytes. And if we see 19 versus 5 plot, we have the separation of the B and T cells here. The B cells are 19 positive and the T cells are 5 positive. B cells are negative for CD5. You see a small spray of CD5 positive cells, which is okay. You have to remember that some B cells in the mantle zone can express, normal mantle zone can express a dim CD45, very big CD45, sorry, dim CD5, and that is normal. And the B cells express partial 23, which is normal, FMC7 is negative, CD200 is partial, so nothing abnormal here. And they again show a nice kappa lambda polyclonal B cell population. They are negative for 103, negative for 56. So 103, if you remember, is a hairy cell marker, so that is negative. Anyway, we see only polyclonal B cells. So there is nothing neoplastic or abnormal in the B cells. Now, moving on to the T cell tube. Here we see that the T cells are CD3 positive. There is a small population that shows negative for negativity for CD7, which is normal. We always see a tiny population of CD4 positive subset, especially of the T cells that show loss of CD7, and that is usually reactive, so that's okay. The T cells express nice CD5. They're positive for CD2. The important plot in this case is this one, the CD4 versus CD8. And we have a population here that expresses CD4 and also kind of goes all the way to express both CD8 as well. So we have a small population of 4 and 8 double positive T cells here. So when we gate them, they're almost around 15%. And they express nice CD3. And there is really nothing different in the intensity of expression of any other T cell markers in these cells, except that they are 4 positive and are trending towards being both 4 and 8 positive. So we have a population of 4, 8 double positive T cells in the background. So what is the utility of this population? So in nodular lymphocyte predominant Hodgkin lymphoma and progressive transformation of germinal centers, in these two conditions, it has been noted that we have a background of reactive T cells, which expresses this pattern of 4-8 double positivity. So this patient is a young man with enlarged neck lymph nodes. So this was a core biopsy. And when we submitted the specimen for flow, we saw this. Somehow the core biopsy was so tiny and it did missed the population or it missed the neoplastic cells in the of nodular Nlphl. So we noted this in flow cytometer and we raised the suspicion for either PTGC or Nlphl. And we said, this is not specific, but this is known to be seen in these conditions. So do a rebiopsy. So when they did an excision, we saw nodular Nlphl in the lymph node on this patient. So this is just to bring your attention to some subtle findings that may be very helpful in practice when in flow cytometer. So when you see in a lymph node, everything is normal. If 4-8 ratio is very high, that is indicative of either there is a neoplastic process, again, like NLP, nodular lymphocyte predominant Hodgkin lymphoma, and Hodgkin lymphoma can have really high Fourier ratios, sometimes, more than 15 or even more than 10 is high. And when you see a double positive, Fourier double positive population, you should think about nodular lymphocyte predominant Hodgkin lymphoma or PTGC. It doesn't have to be there, but it is definitely recommended to look for those conditions. Thank you.